We got like one complaint about it.
Yeah.
We're live now.
Oh, okay. So this is Ford Brewer again, here with Dr. Jesus Vega and Dr. Bret Scher. Dr. Bret Scher is a cardiologist. I've been a big fan for a long time. He's got the channel and the website Diet Doctor, but he's focusing a lot more on health and diabetes these days. Now, just a couple of quick questions for you, Dr. Scher. What do you think about the connection between diabetes and cardiovascular disease?
Yeah, I mean, there's such a strong connection with diabetes and cardiovascular disease, but I would take it one step further and say if we're waiting for someone to get type 2 diabetes before realizing they're at risk, then we've really missed the boat big time.
Oh, yeah.
Because not just pre-diabetes, but insulin resistance and metabolic dysfunction predate type 2 diabetes by years or decades. And the risk is building. And if you look at studies that say what predicts risk of future heart disease, you know, LDL, ApoB, they're on the list, but even greater are insulin resistance scores, and then of course type 2 diabetes. So paying attention, you know, farther upstream to when people are getting metabolic dysfunction and insulin resistance is so important for preventing cardiovascular disease, because we can always talk about treating heart disease, but don't we really want to prevent it? And to do that, I think we absolutely have to be more mindful of metabolic dysfunction because there is such a strong connection.
You were asking earlier about our channel. There's one purpose, major purpose for our channel, and that's to help those 52% of us, age 18 and older, that have prediabetes.
Yeah.
And this is not a guess, this is National Health and Nutrition Examination, so enhanced. And 90% of them don't know it. So over half of us have it, 90% of us don't know it. And so we do, for example, we have patients, one of the first things we do is do a Kraft insulin survey, OGTT and insulin response. Mm-hmm. So the other thing I wanted to ask you, I know you've gotten into mental health and diabetes disease. I guess that you would think that's one of the big developments right now in this space.
Absolutely, yeah. So you mentioned in the intro about Diet Doctor. So when I was with Diet Doctor, we were really focusing on ketogenic interventions, metabolic health in general. Now I'm with Metabolic Mind, and what we really are focusing on are ketogenic therapy for treating serious mental illness. And it is remarkable how the brain functions better when it's running on ketones. And that's a very general statement that a lot of people say, wait, what do you mean? But ketosis, therapeutic ketosis, can help with seizures and epilepsy, can help with cognitive decline and dementia, and can absolutely help with mood disorders and serious mental illness. Because it's clear that when the brain has insulin resistance, it's not creating energy well enough. Just like when our body has insulin resistance, we're having a harder time bringing in glucose to burn for fuel. Well, the same thing happens in your brain. And when your brain's not efficiently creating energy, a whole host of symptoms can occur. But when you can fix that, when you can treat the metabolic dysfunction in the brain, give the brain an alternative fuel source or even a better fuel source with ketones, it's amazing how things can change. So that's what we're really focusing on at Metabolic Mind. We're a nonprofit initiative, a Bazooki group, and the research and the clinical experience that is now exploding about this connection between metabolic health and mental health is just so inspiring. And actually here at this conference, Dr. Eads' talk, she phrased metabolic psychiatry as a path of hope. And that's really what it is. For people who've been diagnosed with treatment-resistant mental illness, this is a path of hope that they actually can get better and get back to their lives.
Well, speaking of two things, you mentioned a minute ago waiting till somebody has a diagnosis.
Right.
To our current medical system can make a diagnosis of diabetes. You know, the literature is replete with this comorbidity between full-blown diabetes and anxiety and depression.
Yep.
And it's like, wait, don't wait for that. Let's move that a lot earlier.
Yeah.
Again, years and decades earlier.
Yeah, there's such a strong connection between people with type 2 diabetes developing mental illness and people with mental illness developing type 2 diabetes, right? It goes back and forth. Right. Absolutely. So whichever camp you're in, if you can intervene earlier, you're going to prevent that from ever happening and just benefit someone incredibly.
Excellent. So again, we've got our viewers out there. Anything else for them before we go?
Yeah, I mean, the key is, one, if you're living with or just trying to improve your health, advocate for yourself. Do your research. Go to Metabolic Mind. Go to Dr. Ead's website. Go to Dr. Palmer's website. Go to Nicole Laurent's website, who just gave a talk. Really advocate for yourself, because unfortunately, despite all our best efforts, as you know, not enough physicians know about this.
Yeah.
And sometimes the patient, the individual, needs to be the educator, or at least the guide to help the physicians learn. And that's really what we want, this sort of grassroots movement to help everybody learn more and make this more of a common treatment.
Thank you again, Dr. Bret Scher.
My pleasure. Thank you.
Okay, great.